Hello everybody, and I'd like to say thank you for coming back and welcome to a special episode. This is not Cities Skylines, well, what you're seeing is, but this is not a Cities Skylines episode. Similar to the State of the Channel video I did sometime back, I'm just using Cities Skylines as just a backdrop for what I'm about to say. The title of the episode, or the video as you saw, is Being the Battleground, and it's about my experiences with cancer. Now, the cancer I had, clear cell carcinoma, is nowhere near as terrible as some of the other forms that people have suffered through and have not made it through. But I can sympathize with them now. This will probably be a difficult video to sit through, let alone record. And my intent here, like I said, is really to just explain what I went through and my experiences, and hope that if you ever have to do this, which I hope you don't, or you know somebody who does have to go through this, you'll have a better understanding of what it is that they're going through. I'm going to start at the beginning, despite the fact that I had already gone through some of that in the other video, but I'm going to just encapsulate everything in this video as well. So we're going to set the Wayback Machine to Thanksgiving weekend of 2018. I was visiting a friend with another friend in Dallas, and during the weekend I started to develop a ulcer in my upper left palate, the hard palate of my mouth. And it was about the size of a dime at one point, and there was not really a lot I could do since I was out in Dallas, and it was a Friday night, Saturday morning. Not a lot you could do. I just figured, oh, it'll go away. And it didn't. And I got home Saturday evening, back to the Detroit area, and Sunday I had a rehearsal for a show I was in, whose director also happens to be an oral hygienist, and she took a look at the ulcer and said, you need to get in to see somebody right away. And she set up a referral for a doctor that Monday, and that was Dr. Nichol, and went in to see Dr. Nichol. They did a not an x-ray, but like a 3D scan, I guess you would call it, of what was going on there, and then scheduled another appointment a week later to have a biopsy performed on whatever this thing was. That they did say there is something there that needs to be looked at. So we're now into early December, and I had the biopsy. And the biopsy results took a while. The pathologist's report took a while. It went to 4 different pathologists. It did end up at the University of Michigan Cancer Center, which was an indication that it was a tough case. And it turns out it is clear cell carcinoma, a form of cancer that normally is not in the mouth, but normally in the female genitalia tract. Now, then that came in, those results came in just after Christmas. Dr. Nichol then referred me to a Dr. Ramirez, Carlos Ramirez. And by the way, both of these doctors are highly qualified. Both of them have degrees in dental surgery, or a doctor of dental, as well as medical. And Dr. Ramirez as well is an oncologist, specializing in maxillofacial. So I had an appointment scheduled with Dr. Ramirez. Unfortunately, the first appointment, I did tell them, even though it was scheduled for 3 o'clock, I had to be in. I had another appointment that I could not miss at 6 p.m. that day. And by about 4:30, when Dr. Ramirez still was not able to see me on that day, I had to leave that appointment so I could make my 6 o'clock rescheduled for the following Thursday. So that delayed things just by a week. But then the following week, Dr. Ramirez was able to see me, looked at the biopsy results, and also took a look firsthand at the growth, examining it directly, I should say, and decided the best approach was surgical removal. So a date was set. I had a cruise coming up. You may remember with a drop in the series for a little while that I had a Trans-Panama Canal cruise scheduled. I told Dr. Ramirez I'm not rescheduling or missing that. So he scheduled the surgery for almost like 2 days after I got off the ship. March 5th it was originally scheduled for. While on the cruise, I received a notification that the surgery had been moved to March 8th. And then again, while I was on the cruise, I received another notification that it had been rescheduled to March 9th, which is a Saturday. And that would be the final rescheduling, that was pretty much a 95% certainty it would happen. March 8th, I received a phone call that the procedure was scheduled for 6 a.m. at Ascension St. John in Detroit. So I prepared myself. I started to get things in order. It was planned that I would be in the hospital for up to 4 days. So I planned on being in the hospital for 4 days and then recovering at a friend's house, Jeff's, for about up to a week after that. So I was planning on being out, away from home for 11 days. I left work on the 8th at about 1 p.m. telling them I need to go and get ready for this. I left work, went straight to Jeff's. He was still at work himself. It's only 1:30 in the afternoon here. So once I got unpacked there and settled in and ready there, I went to the mall nearby, went to Macy's, and got one of my comfort foods, knowing this would probably be my last meal for about a week, maybe even 2, depending on afterward how long it would have to be. So I got the chicken pot pie, one of my favorite things, and just had a nice lunch sitting at Macy's at Oakland Mall, looking over the rest of the mall from their balcony restaurant, and just enjoyed a quiet lunch, and then went back to Jeff's and got myself prepared for the following morning. At about 4 in the morning, Jeff woke me up, showered again. They wanted me to shower like 3 times in the 12 hours prior to going to the hospital. So did that. We got to the hospital about 5:40, 20 minutes early. Checked in, got to registration, and they put us in the little waiting room where you had to put the the non-gown on and the little footies that you put on, getting ready for the procedure. And then we just sat there for a while. Jeff and I just sat there waiting and waiting. And then suddenly the charge nurse came in and said, "They're waiting for you upstairs." Well, okay. Well, it's not like I've been holding anything up here. I've just been sitting here waiting for you. So they whisked me off, sent Jeff to the waiting room, and whisked me off to pre-op. I sat in pre-op for about 15 minutes. Dr. Ramirez came by. Dr. Bohr came by. Another doctor came by. I forgot his name. The anesthesiologist came by. Tammy, the nurse, came by. Another nurse came by. And that was about 7 in the morning on Saturday. And then that's all I really remember. I don't even remember being wheeled into the operating room. The next thing that I do remember was opening my eyes, or well, actually just hearing, not even before opening my eyes, was hearing a angry machine, like square wave noise, along with a whooshing sound right in my ear, my left ear, as well as just in an ambient manner as well. I opened my eyes, and there's another pair of eyes staring right back at me, only about 3 inches, 4 inches from me, and a surgical mask. And I recognized him immediately as Dr. Bohr. And he was finalizing inserting the feeding tube, which went up my right nostril, through my throat, down my esophagus, bypassed the stomach, and right into the small intestine. And that was the feeding tube. He was just finalizing getting that into place. Apparently I was a difficult customer. He explained I had a tilted stomach, and an interesting fact, this is a result of how I slept in my mother's womb. That he explained if you were a back sleeper, you tended to have a normal stomach, which most fetuses do. If you slept on your side, then you had this risk of being having a tilted stomach, and it also meant that you would probably sleep on your side for the rest of your life, which I actually do myself. So, but that's just an interesting fact that I remember him telling me. Now, I did kind of bypass the one thing of the general anesthetic. If you have never had intravenous general anesthetic, and this is where it goes right into your bloodstream, it's not the gas. With the gas, it's out of your system in a couple hours. Maybe 8 hours at most. With intravenous, it's in there for a while. And I will say it was a very difficult sensation to deal with. At first, I could relate with Pink Floyd's Comfortably Numb, but the comfortable part wears off fairly quick, and then it's just numb. As well as a great deal of lethargy. there would be many times I would instruct my hand to move, but I would not receive feedback on that for seconds, 2 or 3 seconds. So it would be the same as, you know, moving your hand and then telling your hand to move, and then, okay, now I sense it moved, but your hand's already been there for about a second and a half. So just a very unusual sensation that will become relevant in a couple evenings. So Dr. Bohr finalized putting the feeding tube in and asked me the standard questions. What is your name? What's your birthday? Do you know where you are? Where are you? What year is it? Who is the president? I had to think about that one. And then, you know, I breezed through all of those except for, do you know what day it is? And I said Sunday. And he replied, well, it's actually Monday. So I have no recollection of March 10th, 2019 whatsoever. Now here in the United States, March 10th happened to be the beginning of daylight saving for those states that observe it. A lot of people lost an hour. I just lost an entire day. Now I'm going to explain what happened on Saturday, and this is second-hand hearing from doctors, nurses, and friends and family. I went in at about 7:30, and Dr. Ramirez began his procedure. The procedure was to remove the tumor and 1 centimeter of all tissue, bone, teeth within 1 centimeter of where the tumor is spread to. This ended up being approximately 3 centimeters by 1 centimeter by 1.5 centimeter. That's a lot of tissue, and that's the size of the tumor itself. Now add another centimeter in each direction to that. Thankfully, the tumor was very close to the surface of my palate, which meant a lot of that 1 centimeter was negative space that was just, there was nothing to remove. However, Dr. Ramirez had a lot of work ahead of him. He had to remove all of that, and because of its location so close to the brain, so close to the hinge of the jaw, this was not something that could be done easily. There had to be a lot of attention to not nicking certain nerves, because if a certain nerve was nicked, my jaw would be permanently, effectively like lockjaw. My jaw would just never open again. And then, on top of that, reconstruction also occurred at that same time. Now, reconstruction was removing fatty tissue from my wrist and putting that into place where the tissue was removed, as well as creating a little, I can only describe it as like a blob of tissue to simulate where the 3 teeth were that came out on the left side of my mouth, to continue that enclosure that the teeth usually would provide. Then a skin graft came off of my right leg to cover where the fatty tissue came off of my arm. So I've been joking with people, telling them that whenever I shake hands with somebody now, I feel like they stuck their finger in my mouth. But this also involved a vein, or, you know, the tissue that came out of my wrist also had to include a vein, because of course that tissue has to receive nutrients from my body. So that vein had to be, that was severed from the old diseased tissue, had to be reconnected to this fatty tissue being put in. This ended up becoming a 14-hour procedure. I never realized, and think about it, for somebody to stand there for 14 hours, having to have the precision to reconnect a vein, to cut out tissue, to make incisions on the side of somebody's head, to do all of this over the period of 14 hours. I admire the entire staff that had to do this. Dr. Ramirez, the anesthesiologist, Nurse Tammy, and I do not know the other two people that were present. So after 14 hours, they sent me to the ICU for recovery or an observation. About an hour afterward, a clot had formed in the vein that they had reattached. This sent me back into the emergency room for another 2 hours as Dr. Ramirez worked on getting that vein unclotted and reattached properly. This is why I don't remember Sunday. According to Jeff, it was approximately 1 a.m., 1:30 a.m. by the time he got home, because he stayed until I got out of the OR the second time. So that kind of adds up to all the math. 7:30 a.m. plus 17 hours works out to about 24:30, which it would be 12:30 a.m. Sunday. So that is a very long time to sit and wait. I apparently had visitors on Sunday. My aunt, her sister, and a couple more of my friends and my sister had visited, but I have no recollection of Sunday. So Monday rolled around, and there were some visitors I had. Jeff was there, Mike was there, Ken was there, and Kim, my sister, was there, and John was there. If somebody else was there, I don't remember, I'm sorry. But what was weird about this, and this was in the ICU still, they weren't all in the ICU room with me at the same time, of course. I could clearly see the wall. I could see the window and make out the buses going by on Morass Avenue. Or Morass Road, whatever it is. Admiral Ross. They looked like Q-line little trams to me, but they were just buses. But I could clearly see them. What I couldn't see were the people standing between the wall and me. It was the weirdest thing. They had to be either 2 feet away from me or way back against the wall. I couldn't sense anything about 6 feet away from me. It was just odd. Very weird. And everything was just in a really unusual state. Now, movies and television always try to simulate this recovery process from anesthetics, and what they cannot get right is that tactile sensation. They kind of get the vision thing right, they kind of get the sound thing right, but there's no way you're experiencing it until you are also experiencing the tactile part of it. By that I mean the lethargic response of you know, the delay in response from acting on something and having it actually happen. The they just cannot get that right. It is a truly unique experience, and like I said, comfortably numb for about the first hour, and then just numb after that. The comfort disappeared Monday afternoon, Monday evening. That's when the discomfort started. It wasn't pain, just discomfort. So Monday evening I had visitors, but I was in a talkative mood, but it was very difficult to speak. I, of course, had just had surgery on my mouth, and it was as dry as the Sahara Desert. My lips were so dry and caked. It was just, it was difficult for people to look at me. And there were other reasons for this too. I had yet to see a mirror, so I wasn't even aware of what I looked like. However, I know I was difficult to look at. I was not a pretty sight. So my guests finally filtered out around 8 o'clock to let me get some rest. Now, if you've been in a hospital for an extended period of time, this is probably not news to you, but for many of you that you've never stayed at a hospital is for pain management. That's what its goal is. Comfort is not part of that. There's a difference between comfort and pain management. Pain management is ensuring that there's no pain, obviously. So keeping that pain under control, the sutures, the swelling, the that kind of stuff. Comfort, we tend to associate a lot of discomfort with pain sometimes, is really, that's something that they'll try, but it is not their primary concern. And I will tell you, lying in a hospital bed, especially since I am a side sleeper, was not comfortable. My bed faced the clock, which unfortunately had a second hand on it. And all I did Monday night was stare at the clock, because that was the only direction I could have my head turned, and just watch that second hand go tick, tick, tick. I couldn't really even look out the window because the window was the other way. I couldn't turn my head. My head was turned to the right because all the incisions and everything was on my left. That's all I did Monday until Tuesday morning. Just stare at that darn clock. I could not fall asleep. I could not get comfortable. I did rest in a way, but that's all that happened. It was no comfort, no sleep. This is not because of the nursing staff. It was just that was unfortunately the way it was. Tuesday, Jeff showed up. I think some other friends may have shown up. I don't remember exactly. I believe Susie and Judy, my aunt and her sister, as well as Susie's son JP, showed up. Jeff was there. I think Ken showed up in the evening. And I think Mike showed up. Again, I just don't remember exactly who was there. My sister was there, of course, too. But I was still really, now I was in that uncomfortable, cannot sleep, cannot concentrate state. Tuesday, despite the fact that I was pretty much conscious for the entire day, I wasn't really aware for the entire day, and it was just hell. Tuesday night, about 9 o'clock, the people that visited me, I'm so grateful, because believe it or not, the best part about visitors was just if there was more than one visitor especially, there could be a conversation between them that I could be part of, I could live through vicariously, and that helped pass the time. When there's just one person there, I couldn't have a discussion, so it was just one person sitting there. And it was really difficult on them as well as me, because it's just sitting there. And, okay, well, they're just sitting there. Jim's not talking, and I'm not talking, so, So, Tuesday, about 9 o'clock, one of the nurses turned on the television. It was on TBS, and that was like 4 episodes of Big Bang Theory. Okay, I enjoy Big Bang Theory. I drifted in and out on that. My eyes were closed, but I was just awake for most of it. And by the way, that whooshing, angry noise, by the way, is going on the entire time, by the way. Ever since Monday when I woke up, it's still going. And that's a noise that everybody in the room hears too. That was the result of a Doppler device that was hooked up into my ear that was monitoring the blood flow in that vein that was reattached. If there was no noise, that was a bad thing. So it was kind of a terrible, you had to hear this, which meant it was a good thing. And it just kept me awake, but anyhow. I regret the television having been turned on. By the way, there's no way to turn off the television from the bed. Because on a personal note, I don't watch live television anymore because I just can't deal with the ads. They are so irritating and annoying. And TBS is nothing. All the ads are try this drug, try that drug. And when you're in the state that I was in, it was almost I can't think of the word. Brainwashing, not quite the right term there, but when you're in the state I was, and ask your doctor about Flaxablack or whatever, and ask your doctor about this, about restless leg syndrome, about dry eyes, about whatever. I mean, everything. The worst was a KFC commercial that I just recall hearing. You have 4 seconds to comply. Just out of nowhere. And in the state I was, it's like, what happens if I don't? Excuse me. Sorry. That television stayed on until about 9 the next morning. Finally, one of the nurses that was in there could figure out how to turn it off. The only way to turn the television off was to use the actual power switch on the unit itself, which of course I couldn't get to. So Wednesday, I had more visitors. I was still feeling pretty bad. Now, if you've been doing the math, this is now day 5, when I was expected to be there for only 4 days. That was the day that some of my senses were starting to return, The lethargy was mostly gone, but it was still hanging on, and the worst of it was still yet to come. After about, Wednesday day went by like all the days do. I had visitors. Forgive me for not remembering everybody that showed up. I had, by the way, thinking of visitors, the other reason you can't rest is somebody comes into your room every hour throughout the night. For me, in the beginning, every hour they came in to do vitals. I can understand that. Blood pressure, temperature, pulse, oxygen, blood oxygen. I could understand that. But every 2 hours they did a blood sugar, which meant poking. If you know those little stabby things that go in the finger every 2 hours. Another thing is I had 6 IVs hooked up to my right arm, one of which was heparin, which is a blood thinner, and that was about midway between my elbow and my wrist, and it dictated where the remaining IVs went. They had to be between that and my wrist. So I had 5 other IVs in there. Plus, every 4 hours, they did a blood draw, and they did not put a pick in. So they would come in and dig a needle into the back of my hand and draw blood every 4 hours, and then that vein couldn't be used again. So then the next time they came in, they had to dig into another vein on the back of my hand. Backing up a little bit, by Tuesday morning, there was nowhere left to draw blood from, and they had to bring in a specialist, an IV specialist, to locate a valid vein from which to draw blood. My right arm could not be used whatsoever because of the tissue transplant. So all this had to happen in those 6 inches, or the back of my hand. My left hand was so calloused and dry and bruised, it looked like a purple piece of cauliflower. And this was just Wednesday. Now, Wednesday night was probably the worst night of the entire stay. Starting around 10 p.m., I was becoming uncomfortable. Mind you, I've been laying on my back the entire time. I think I did get out of the bed Wednesday. I think it was the first day I got out of the bed, sat up, and got, with assistance, over to the chair, and sat in the chair for about an hour and a half, and then went back into the bed. But the entire time you're in the bed, you're just laying on your back, slightly elevated head. So I'm laying there, and what I thought was my salivary glands starting to come back up again, and just, normal drainage into my throat and swallowing. It turns out I was wrong. This is going to get a little graphic. They had to remove a portion of my mucous membrane in my nasal passage on the left side. With the heparin running, which is a blood thinner at 1200 units per hour, this incision was not clotting. It was just bleeding. And it turns out that was blood that was going down the back of my throat. And as my body just started giving up on even the consciousness, because I could barely maintain consciousness at this point. I was starting to drift off. But when that happened, the blood would pool in the back of my throat, and I would start to choke on it. Now, the lethargic responses that I was talking about earlier, the worst part of this was I would sense it happening. I would cough up the blood. They just gave me this tub that I just kept on my chest, and I just coughed into this tub. I would do that, and it would occur to me, because of the lethargic response, by the time I realized it was happening, it had already happened. So it was like a reverse of seeing the future. You saw it happen and everything. Well, maybe it was like seeing the future. I don't know. You saw and sensed it, or you saw. I saw it visually, and it's like, oh. And then I would sense the actual choking and the coughing up of the blood about 3 seconds afterward. Very, very disturbing. This got to the point where I was doing it every 5 minutes at a minimum, or a maximum, I should say, 5 minutes. More like every 3.5 minutes or so, I would do this. The amount that came up was small, but it doesn't take a lot to choke you, to clog that, especially with the feeding tube also taking up its space down there. So, Nurse Minnie Golo, Minnie we just called her, little 5'4" Indian woman, most wonderful personality of all time, Protestant. I mention that because she came in, she's got, 6 rooms that she's got to watch with 2 other nurses. She came in for about an hour and a half and just sat there next to my bed. She prayed for me. She wiped the blood from my chin. She kept a cold cloth on my forehead. And she talked to me. I could not have made it through that night without her. Sorry. I'm not a spiritual person. Realize I was at a Ascension to St. John, so there was that aspect, of course, but she, with the fact that she took that time to sit there, and not just sit there to make certain I didn't choke on my own blood, but to provide comfort. Like I said, a hospital is not comfort, it's pain management. So the fact that she treated me as a human, which the nursing staff there does, don't get me wrong, this just proved how wonderful nurses are. I will always remember that, despite the fact that it was still fuzzy. But I will always remember Nurse Minnie. I hope Jeff got her fish curry recipe, because he loves curry. So Nurse Minnie, you probably will not listen to this, but thank you. Thank you. That started to subside, but the bleeding did continue, but it subsided about 1 in the morning. Now, every morning at 6 a.m., Dr. Bohr, B-O-H-R, came in to check on me every morning. Thursday morning at 6, he came in and he was made aware of what happened the prior night. He took a closer look at me. They lowered the heparin from 1,200 units to 700 units. And he also returned every day with his with his residents. So there were, I think, there was the fellow for Dr. Ramirez, and I keep forgetting his name. I apologize for not remembering that. And then 3 others that came in at about 9 o'clock every day. So Dr. Bohr was there at 6. He took a look at me, had a plan of attack, and then told me when he returns at 9 with his residents, they'll do something about this. So when they got there at 9, all of them took a closer look at me, and it was decided to pack the left nostril. Now, what they did, and this is the way Dr. Bohr described it, imagine like a 3-inch long tampon, complete with a string attached to it. And they just shoved that right into my nostril. And I shouted out as they were doing it. He did warn me this is going to be extremely uncomfortable and painful. I do remember shouting out, "Did you find my wallet?" Because it felt like it went all the way down to my back pocket, even though I wasn't wearing jeans at the time. But oh, by the way, you lose all modesty when you're in a hospital. It doesn't matter. Once a stranger wipes your ass, your modesty goes out the window. So after doing that, and he was very good about it. He, was like, "I'm really sorry that had to happen, but we had to do it because it was not clotting." And then they basically caulked it shut as well. I mean, it literally looked like caulk. It was just white paste, basically, that they then just sealed up the left nostril. Well, my right nostril was already in a state of, 30%, as it were. This now meant I was breathing entirely through my mouth and no longer through my nostrils. Not that I was really doing that very clearly in the first place, but now 100% was going through my mouth. And I do remember, one of the friends that did visit me, I know a lot of mics, and this is another mic, set the way back machine to the 90s, wrote and published his own role-playing system called Gatecrasher. And there was a table of random gifts that you would receive. I think it was like every other level that your character went up or something like that. But it was a D100. But I think it was 0 and 1 were critical failures. Remember, this is before the standardization of D20. And that it was a curse. And the curse was conscious thought required for breathing. And that is what it turned into starting Thursday morning. It was conscious thought required for breathing. I had this... I realized I had still not seen a mirror. But I'm still drifting in and out. My body is fighting me staying conscious, yet I can't fall asleep. So I had these horrifying images of a hole in my forehead that I had to blow into in order for me to receive breath. I don't know why, but that is that's the visual I had. I also had a visual of just 2 holes above my lips, and I had no nose left. I just remember this. Thursday went by more or less like most days, but my salivary glands. I don't know why I keep saying salivatory. Salivary glands started to kick in, and they kicked in full force. So that's when the drooling started. I think I went through about 5 boxes of Kleenex. They threw about a case of these little tissue boxes at me. Well, not threw it at me, but left it next to me. That was intended for the guests, and it had like 40 tissue per box. And I went through that entire case on Thursday. So I just drooling because my mouth, I didn't have the motor function to keep it in. And I already am disgusted by even the slightest little amount of saliva on my lip in the first place, that this was absolutely disgusting me. But there was nothing I could do about it. And it also, again, made it very difficult for people to look at me. So that was also the first day Nurse Liz, Michael's wife, came over. She's an RN, and they literally lived so close to the hospital that if the other wing of the hospital hadn't been present, I could have seen the house and even made out the car in their driveway. That's how close they lived. So they dropped in a lot. But she had been getting over a cold, and of course you don't want to bring a cold into the hospital. So she was finally able to come visit on Thursday, and it was good to see a new face. And she was completely professional. She knew this wasn't her show, so she just was a good friend and explained things to me that I didn't understand, that she could explain in better detail, but in no way did she try to, tell the nursing staff or anything what to do, because, of course, it wasn't her show, as it were. So I appreciate the fact that Liz came over to just help me through that as well. Thursday night was also the night that I call her Helen arrived. Now Helen was another patient 2 or 3 rooms down from me who was suffering from dementia, and she had no idea where she was. She would shout, help me, somebody call the police," or she would start with, "I'm falling through the floor, he's standing right there, he's going to get me." She tried to rally the entire floor into freeing her at one point. She went nonstop for 20 minutes, and then would be quiet for about 30 minutes, and then would start up for another 20 minutes. By the way, if you've been doing the math, this is Thursday, that's now day 6. So imagine that going on, the noise from the Doppler, the inability to sleep. I still had not fallen asleep. If I did, it was maybe 10 minutes. Maybe 10 minutes at a time. I was absolutely exhausted. I was beginning to get angry. Because, of course, exhaustion, that's one of the first things you do is you get angry. I was starting to take a little bit of it out on the staff because they would come in and ask me something like, when was your last draw? You know, and I don't know. I mean, isn't there a chart you're supposed to be looking at that this is written down on? So I was getting upset at them. I was starting to get out on them, and I shouldn't have, but when there's no real excuse for that. You know, you can say, oh, well, you were exhausted, and that's true, but I was conscious of the fact that I was being that way, and that's what I don't like about it. Because normally I'm not that way. I don't get that way unless I'm exhausted. Thursday night, aside from Helen, was the same as every other night. I couldn't read because I couldn't hold a book. My right arm, I should say, was in a giant bandage. So I couldn't even hold a book. I tried to use the iPad for watching some television shows that I had, but I just couldn't. I had all these books and everything, but I just couldn't do anything with them. So Friday rolls around. Again, it's all just a big long blur at this point. I can't remember if Friday was the day that Liz and Mike showed up again, and we played Guillotine, which is a little card game. A fun little card game that we played. And I enjoy it, and it was nice to be able to do something to concentrate, or at least give my brain something to think about. I mean, I couldn't even do crossword puzzles or anything because there was just no way to hold on to anything. So I could look at my cards in my hand, you know, something like that, but anyhow. So Saturday, Dr. Bohr came in, looked at me and said, it looks like we're going to be able to get you out of here today. And that was the best news I had heard. Now, if you're doing the math again, this is day 8. Going in, I expect a date, at most 4 days. So we should be able to get you out of here today. So they started the discharge process at about 9 that morning, and I told my friends they're discharging me, or they're in the process of doing it. We got, you know, the room was actually, they were starting to clear the room out a little bit. About 2 o'clock, I don't know what happened. Before they would discharge me, a medical supplier had to deliver supplies to Jeff's apartment before they would discharge me, or at least confirm they were on their way. Somehow they ended up being sent, instead of to Jeff's, they were being sent to my actual house, my home. And I don't know why that happened. We notified them multiple times in advance, that, you know, this is where everything goes, is to Troy, not to Waterford. Everything goes to Troy. Because of that, the supplier couldn't guarantee delivery that night. The hospital would not discharge me. That was one of the most disappointing things I had ever had to suffer. So I had to stay Saturday. Helen, by the way, is still going. Had been going since Thursday. Sunday morning rolls about. Dr. Bohr came in like he always did and said, okay, we're going to get you out of here today. So I got my hopes up again. About 10 o'clock, the caseworker came in and said, so we're going to have to hold on to you tonight. And I'm like, well, wait a minute, Dr. Bohr said I'm out of here. And she said, oh no, we can't discharge you. They don't deliver on Sundays. I said, is there any way to do an exception? I mean, come on, there are people that need deliveries on Sundays, I'm certain. Nope, no exceptions. So, because of fucking Benson's can't send one person out on a Sunday to make a delivery, I had to stay another night at the hospital with Helen. Realize I still hadn't gotten more than maybe 15 minutes of sleep. Dr. Bohr did come back at about 10 and apologized for saying that. He said if he had known that was the case, he wouldn't have told me they were discharging me that day and got my hopes up like that. I didn't blame him for that. I blame Benson's for that. I mean, really, how difficult is it to just send a driver out with a case of nutrients and a pump? Especially when Jeff lives, I think, like 2 miles from the store. No exceptions. They had no problem charging me, by the way, $1,800 for all the equipment. You would think for the $1,800 they could have had a driver take care of that on a Sunday. You know, but it's St. Patrick's Day, so of course the driver, you know, they didn't want to interrupt the driver's St. Patrick's Day. My St. Patrick's Day was less valuable than the driver's, apparently. I don't care if that's standard procedure or not. To hold somebody for one night just because the medical supplier will not deliver is bullshit. So I'm not happy with Benson's. Monday, it was confirmed I will be discharged on Monday. Dr. Bohr came in again, and he removed the sutures in my right arm, and they cleaned me up somewhat. By the way, the left side of my face, I forgot to mention, the first time I got to look in a mirror was Thursday afternoon. I was not a pretty sight. I had to back up here. The left side of my face was completely swollen. I looked like a misshapen melon. Literally, the left side of my face was just swollen outward. Now, the incision went right along the seam between my ear and my side of my, like my sideburn. And Dr. Ramirez did an amazing job. In fact, right now you can barely see the incision. But it was still caked with blood because they didn't want to touch it. I also forgot that the pack that they put in came out on Saturday. And that the bleeding had finally stopped. That was another unpleasant sensation where literally he just had to yank it right out of my nostril. And the bleeding had stopped, and then the heparin went back up to about 1,100 units shortly after that. But going back to Monday, I packed my own room. So I packed up all my stuff on my own. I dressed myself. I took a shower for the first time in 10 days. I told the nurse I'm just gonna, the bathroom, I had my own private room, by the way. The bathroom had a giant shower with a fold down bench, and I just told the nurse I'm just gonna sit on the bench and let the water run over me for a while, which was sort of true because they said I had to keep some of the wounds on the left side of my face dry, so kind of like mostly watered on me. Showered myself, cleaned myself up as best as I could, packed myself up. I was still a little slow. I still had the feeding tube, which went down to, from my nostril down to about my belly button. And it would just like swing all over the place. It would get caught on things, snagged on whatever was nearby, it would get snagged on, and then yank on my nostrils. But aside from that, and the Doppler, which was this little wire that came out of my chest, and was on like a 6-foot wire that I had to watch out for as well, that's what really limited my mobility. But I was able to pack myself up. Mike, who lives nearby, didn't expect me to get discharged that early. So he goes into like a private mode between like 10 a.m. and 11 a.m. every day. And that's when I sent him a text message saying I'm ready. And he unfortunately didn't get it till about 11:30, but which was fine because he only lived like 5 minutes away. And he came in and we verified I got everything. I did the final paperwork with the nurse. They offered the wheelchair, which I took, because my understanding is if you fall down while you're in the hospital, they put you back in, and I did not want to go back in. So I took the wheelchair. They wheeled me all the way out to Mike's car at the entrance, got me into his car, and that's when I was able to be outside. And it was a cold, crisp day, but it was sunny and clear. And he drove me to Jeff's, about a 40-minute drive. Got to Jeff's, unpacked his car of all the stuff that I had. He also gave me one of his a shower chair that they happen to have, and some pads for the bed, because at this point I was still doing a little bit of bleeding and my bowels weren't quite still under 100% control. So these pads were there to protect the mattress. So we took care of that, put all that on the bed, got all that taken care of, and got to Jeff's. Jeff had to work that day, but you know, he got there at about, I think about 1 o'clock. Actually, no, he was there when we got there. I'm sorry, he was there when we got there at about 1 o'clock. And all I wanted to do was just, really, I wanted to sleep. Now that that Doppler was no longer going, 10 days of that Doppler, listening to it, when Dr. Bohr turned it off on Monday, it was so sweet to not have to hear it. And I'm sure the rest of the patients on the floor were very happy about that as well, because I know the patients on either side of me, the rooms on either side, could hear it as well. So I also had a little plush shovel knight in the hospital with me. Now this little guy, yeah, I'm a grown adult male, and I have a little plush shovel knight. He was with me for a good chunk. I think he showed up on Tuesday at the hospital. Jeff brought him. But I just called him my pain buddy. When he was nearby, it just helped with my pain. So kind of like a therapy night. So the first thing I did do was I cleaned him off. Being in the hospital, I put him in the sink with some Easy Care detergent and disinfectant. Gave him a good cleaning, rinsed him out, tossed him in the dryer. He bounced around for a little while, drying off. But I just wanted to make certain that, he wasn't bringing stuff back with him, as it were. So while he was drying off, I crawled into the bed, and I couldn't sleep. But I could rest. I could turn onto my side, but the feeding tube and the Doppler wire were making things very difficult. But it was quiet. There was no noise. So it was just quiet. And I could close the blinds, and it was dark. So I got some rest. Now, I'm not going to go through every day that I was at Jeff's. I stayed at Jeff's for 11 days. If you do the total math, that's 21 days, 3 weeks that I was away from home. And the other condition about being at Jeff's, I had a home nursing, and this meant, because of that, I could not leave the apartment. Except for 3 reasons that they told me. Ostensibly 4, because I would assume if the building was on fire, I could leave the building as well. But they didn't say that. The reasons I could leave: doctor appointment, church, or a barber. Now, as I mentioned earlier, I'm not really a spiritual person, so I don't go to church. And really, to be honest, I think church is the last place you really want to go when you're sick or when you're recovering, because you're going to pick up something from somebody at church. All the handshaking that goes on and everything. So even as an excuse, I wasn't going to go to church. I did have one doctor's appointment with my general physician, Dr. Varghese, as a follow-up. I was so glad to see her. I trust her. She's been my GP for close to 15 years now, and she was extremely helpful. Very sympathetic, answered all of my questions, verified everything, looked at my chart. She had been kept updated by St. John through my entire status. She told me they were getting daily updates, even hourly. I think it was Monday they were getting hourly, and then starting Tuesday it was like twice a day, and then it was a day daily after that. But so she was very well aware of what was going on. She took a look at everything. She was very happy with Dr. Ramirez's work. By the way, apparently I drew the best lottery on this as a referral, because Dr. Ramirez apparently is one of the best of his field in the region. So I was very fortunate. But that was getting out of the house. At least just an excuse. And her office is about 30 miles away from Jeff's, and also about 30 miles away from where I live. She used to be about a mile away, but then she moved practices, and I followed her way out there. So it was a nice long drive, just a chance to get out of the house, or out of the apartment. And the only other time I got out of the apartment was I went to a barber, because at that point I had about 2 weeks worth of growth. Normally I'm clean shaven, and I had about 2 weeks of growth, and it was just driving me absolutely nuts. So Jeff took me to where he gets his hair cut, and they trimmed me, because apparently barbers don't do shaves anymore. So she just trimmed me up and got me down to like stubble, and that just felt really good too. And that was a chance to get out. And then Jeff and I cheated. We went to Costco. We went to Sam's Club, I'm sorry, to pick up some supplies because we needed more Kleenex, and it was an excuse for me to just do a little bit of walking because I could walk. I had no problem walking, and I just needed to stretch my legs, and his apartment was not really big enough to do any kind of walking around. I finally left Jeff's, I'm sorry, Thursday, fast forward to Thursday the 28th of March. Now, that's when I saw Dr. Ramirez again at his office. And that was my tipping point of, I told everybody, if this feeding tube doesn't come out on the 28th, I don't know what I'm going to do. Because unfortunately, Dr. Ramirez is only on Thursdays for office visits. He does surgery 4 days a week, office visits 1 day a week. So I knew if it wasn't coming out then, it would be at least another week. I was warned ahead of time that, he was triple booked that day at 2:30, but Tracy, the office manager, fit me in and said it could be, like 4 o'clock, 4:30 by the time he sees you, though. So they did warn me. We got there well in time, signed in, and then waited. And I was actually in the exam room at, I think it was like 2:45. But unfortunately, we did sit there for about an hour. Mike, the other Mike, took me. And I mentioned to him again, this feeding tube has to come out. This feeding tube has to come out. Because the feeding tube was limiting my mobility hugely. It was the only way I was getting fed. And I was getting fed between 6 p.m. and 10 a.m. daily. That meant between 6 p.m. and 10 a.m. I had to sit next to this pump that fed 70 milliliters of this protein shake into me, 70 milliliters an hour. I couldn't do anything. I just had to sit there until it was done. I could pause it if I needed to, and I had to because that was also the only way I was getting water. So I would have to pause it, disconnect it, connect a syringe with 50 cc's of water, pump that into myself, reconnect the pump, and then start that up again. So that was the only way I was getting water. I had to be conscious about my water intake, so I didn't dehydrate myself. So literally, what was supposed to be 16 hours really turned into more like 18. Between 6 and about 11. So that's more like 17 hours. 6 p.m. and 11 a.m. because I had to wait until the darn bag emptied. And that wasn't even an exact science because they said, oh, well, it's 1,120 milliliters that you got to put in there. Well, the bag has a mark for 1,100. Where's the extra 20 milliliters? Whatever. Because I had to pour cans of this stuff into the bag. But I just would go into a funk at 6 p.m. every day. I would go into a funk. I could only watch so much television. I could only, listen to so much music. It was 11 days of house arrest, effectively. It was just difficult. It was very difficult not having any of that freedom. And especially with that darn pump hooked up. So that's why I had to have this tube removed. I just had to. I already had planned on telling Dr. Ramirez a number of things if they said no. Dr. Ramirez and Dr. Bohr came in. Tammy came in as well, the nurse. And he looked at it, looked at the flap, as they call it, on my palate. Looked at the scars on the side of my head, hooked up the Doppler again. I dreaded hearing that sound, but thankfully it was only for about 30 seconds, and he said that is an excellent sound. That is perfect. That means that the blood is flowing perfectly through the vein now. So that was also a good thing to hear. My weight, I had lost 20 pounds, but my blood sugar was still good. The weight loss was expected. All my labs and my vitals worked out, or looked very good. And then he talked with Dr. Bohr for a little bit, and then he came back over to me and said, okay, we're going to get that feeding tube out of you. And I will tell you, I've heard very few moments of good news in my life. I was so relieved to hear that that tube was coming out. We're almost done here. So he authorized the removal of the tube, and that was done by Tammy. And she warned me this is going to be a very weird sensation. She said, just go ahead and exhale, and then take a long intake of breath over about 10-15 seconds. Just inhale over 10-15 seconds slowly. When I tell you to. And I did, as she said, and it felt like a little creature was crawling up my esophagus, and by the time I gagged, she had already had it out. So it only took about 3 seconds for her to do it. And immediately, after the gag reflex, I felt so much better, because this tube wasn't sitting there anymore. It wasn't irritating me anymore. And that also meant something else. I could finally eat again. I didn't have to deal with the tube anymore. And I'll tell you, I was so hungry while staying with Jeff. While he was preparing the cat food, I would get, my stomach would growl, because even the cat food smelled good. So they removed the tube, they removed the I'm going to call it the transfer point for the Doppler when it went from the external wire to the internal little tiny wire that was attached to my chest. They disconnected that from my chest, and then they had to remove the tiny wire that was buried within or next to wherever it was. It was on my ear, held there by 3 stitches. Now, and they cleaned the wound where they took the tissue on my arm. And it was nasty looking. I don't have a problem with those visuals though, so I had no problem watching her clean it. It was disgusting, but it didn't cause me any problems to look at. And she cleaned it, removed the sutures that were ready to be pulled out. And that was no problem. But then came removing the wire by my ear and the stitches holding that in. When she started on the first stitch, I started to feel myself fading. And I remember just saying, I'm fading, I'm fading. It was between the pain and the location, and I forget the exact term, vasovagal or vagovasal. I can't remember what it is, but it's a form of shock that I went into. She did finish removing the stitches. They had to lay me down, feet elevated. And it took me about 30 minutes to recover from that. I don't know why. It was just the weirdest thing, that 3 little stitches put me out for about 30 minutes. So finally she took care of that. They got me up to that point. They had cool rags on my forehead, had me breathe, you know, felt like I was pregnant, you know, with the, okay, breathe, you know, and that helped me recover. And that was about 6 p.m. It was a while. And I told Mike, they wheeled me out of the office in a wheelchair, and then Mike took me in the wheelchair down to his car. And I told Mike, we're going to the Big Boy. That was kitty corner from the hospital. This is a different hospital than where I had stayed. Because the Big Boy has the soup bar, and I could get mashed potatoes with something. Because all I could do, and to this day right now, it is currently April 2nd, are mushy foods at this point. So mashed potatoes, pudding, cottage cheese, soups, stuff like that is what I'm limited to at the moment. Now I have been kind of cheating because I've had a little bit of rice. I had some meatloaf that I cut into very, very tiny little pieces and then mushed up. But in general, I've been having a lot of mashed potatoes, a lot of soup, cottage cheese. I'm not a big pudding fan, so not a lot of that. But it was so wonderful. My very first thing I tasted was the zesty, cheesy chicken tortilla soup, which was just such a wonderful sensation to taste something after 21 days of no taste whatsoever. To have that. That was a Thursday, the 28th. I stayed with Jeff for Thursday night, and we had planned, if the tube came out, I would go home on Friday. So Friday, I packed up everything. I had a lot to pack up because people had sent me stuff. I had so many books that I couldn't read. Get well cards. And then all my laundry that I had gone through while I was at Jeff's. All the, my computer I had taken down there. So got all that packed up. And Friday night we went to Big Boy again for dinner. Jeff wanted to do somewhere a little nicer, and it's like, I can't do gourmet foods or anything, let's just do something simple like Big Boy. So that's what we did. So Ken, Maya, Chris, Jeff, and I went to Big Boy. Stayed there for about 2 hours, just enjoying ourselves, having fun. Had my fill of soup and mashed potatoes. I think I even had a little piece of fish because it was a Friday night and they had a fish bar, and the waiter said, just go ahead and grab a piece of fish if you want one. So I grabbed a little piece of cod and picked at that too. So it was nice to have some food. Went back to Jeff's, finalized packing, and then all of them followed me home. And I got home, and as soon as I opened the door, there was my cat, Dax, waiting for me, who I hadn't seen in 3 weeks. So it was so great to see her. And just got down on the floor with her so that, she would be comfortable with me right off the bat. And she just went right up to me, and it was just so good to see my cat again. And then my other cat, Vasha, she came out when she heard my voice, because she's usually pretty shy. And she came out, and same thing, it was so nice to see her after 3 weeks. And my friends helped me get unpacked and situated. Jeff hooked my computer back up for me again because I still have a splint and a big bandage on my right hand, so there was no way I could get all the cables reconnected. So he got that hooked up for me again. That's how I'm able to do this recording. And finally, after they were all done, I thanked all of them for everything. And they all left about 11 o'clock. I crawled into bed. Right after they left, I took my meds for the night. Orally, finally, as opposed to having to crush them up and mix them with water. which was a fun thing to do every night as well. That was an hour-long process, but it was nice to just be able to take a pill and be done with it. Aside from the amoxicillin, which is this giant horse pill, which I had to cut into like 4 pieces before I could do it. But anyhow, I crawled into bed, and being able to curl up in my own comforters and with my heated mattress pad and with my cats and my own pillows, and it was raining that night, and hearing the rain on the roof was just a really comforting sound. I fell asleep within about 20 minutes, and I woke up the next morning, Saturday morning, at about 9:30. That was my first real good sleep in 3 weeks. And folks, I'm on the road to recovery. The pain at this point is just the swelling of the incision and the vein on the left side of my face, or the left side of my head, I should say. But it's almost entirely under control. My nasal passages are still trying to figure themselves out. It is an odd sensation. I don't know if this is a correction, or if this is a temporary, or if this is what's going on. But there are times where it could also just because that portion is numb. I have been told it will return. Sensation will return there. But right now it's numb, so I can't tell there's anything there. And I don't know if this is what's causing when I drink something. Once in a while it just kind of comes right out of my left nostril. And I suspect it's just because that part is numb, and my muscles aren't doing what they normally do when they sense fluids there, which is close that side from allowing the fluid from coming in. I don't know. I really do hope that's not permanent, but we'll see. As I said, it's April 2nd. Another 2.5 to 3 weeks probably of full recovery. That the swelling should finally go down. The doctor said it was the equivalent of being punched in that side of the face 10 times in a row. So the healing is going to take some time, and the swelling is just going to take whatever amount of time it needs to go down. But I'm off all of the meds that they prescribed for the treatment. I'm back to just my normal meds, which is already a cocktail, but I'm just down to those. I'm able to do semi-solid foods at this point. So like I said, I can do some mushy rice, some soft pasta, some soft vegetables. It's a good thing I like cottage cheese. And I really do love soups too, so I'm having a lot of chicken soup, but I need something other than chicken soup too. But the pain is mostly controllable. I still have some Norco as needed, but I don't like using it because it causes me to get really dry. So thankfully it's not going to become one of those withdrawal things that I'm not doing it every 6 hours as it usually prescribes. I'd rather deal with the slight amount of pain than the side effects of the Norco. But I expect to be fully recovered in 2 weeks or so. My follow-up is the 18th with Dr. Ramirez. That's when I hope the bandage and splint come off. And maybe I just have to have a bandage over there now. But as it is with the splint, it's very difficult for me to use the mouse. Which means I will not be doing any recordings of city skylines for a little while, just because it is so difficult to use the mouse. The splint is in the way, and I can use the mouse in the left hand, but City Skylines, like so many other games, the left hand is usually the keyboard, right hand is the mouse. It would just make the episodes really awkward and slower than they already are, to try to do it with one-handed. So, folks, I think I'm pretty much done. I want to say thank you to all of you out there. I want to say thank you to the nursing staff of 6 North at Ascension St. John in Detroit. I want to say thank you to Dr. Nichol, Dr. Ramirez, Nurse Tammy, Dr. Bohr, Dr. the fellow of Dr. Ramirez that I can never remember your name. Thank you. I'm sorry. Thank you to Linda Payton for the referral to Dr. Nichol in the first place that started all this. I want to say thank you to all my friends that came out to see me. I want to say thank you to all my friends that didn't come out to see me that were sick. I want to say thank you to my family. I want to, particularly my sister and my nephews. I want to say thank you to my Aunt Judy and her sister Susie. I want to say thank you to Al Bartlett, who came out to see me from Clarkston Village Players, my theater group. I want to say thank you to Karen McClellan, who also came to see me. I want to say thank you to Clarkston Village Players for the beautiful flower arrangement that the nursing staff reluctantly allowed in my room, and the wonderful card. I want to say thank you to anybody that I've forgotten. It has been a sojourn. I have been offered by Dr. Ramirez to have reconstructive surgery to replace the teeth and bone that was removed. I have to think long and hard about this. And I need to ask more questions of Dr. Ramirez about it, because I never want to go through this again. Originally 4 days was the maximum expected to turn into 10 days. And maybe only, a couple days, 3 days of recovery, turning into 11 days of recovery at Jeff's. I want to say thank you to Jeff. Oh my gosh, how could I forget to say thank you to Jeff for putting up with me for 11 days, for being there just about every day at the hospital, and effectively being my power of attorney while I was out, making the decisions that I could not make. I forgot what got me to that point about the recovery process. It's been long. It's been difficult. I don't know if I want to go through it again. Even if it did mean getting teeth back and possible normal. But I do know if I do have it done, it will be a medical procedure, not a dental, which means that the costs will be mostly upon the insurance company at that point, as opposed to myself, because dental plans, as many of you know, suck. So I have a difficult decision to make there. Is the amount of time that may come up in recovery for that and the recovery process worth the very long-term effects? Because I will tell you, it isn't just the 3 weeks there, it's another 3 weeks. It's the swelling. It's the inconvenience of the bandage and the splint. It's the half days at work. It's the getting back into work, getting back into a lifestyle where I can have a schedule again. So those are the things that I have to make a decision about. At this point, I've pretty much met my deductible for the year, as it were, for insurance. So I've been told I have sleep apnea. I'm going for that sleep study now, because at this point, why the hell not? Everybody, it's been an hour and 40 minutes almost. I want to thank you if you sat through the entire thing too long, didn't listen. Thank you. I needed to do this, mostly because it's one of those things where you just need to recap what happened. You want it down somewhere. And that's the main reason for this. So yeah, another shout out I just want to say, the Haggard Nerd, thank you for the kind words and the thoughts and letting folks over there know what's going on. I want to get back into Astroneer. I really want to get back into Astroneer with you. Unfortunately, it's going to be a while until I can use this. I can use the computer reliably again. I'd love to join you maybe this Friday. Would that be 3, 4, the 5th? But it would probably just be me hanging around the base and doing limited things. But I would love to be able to join you for that. If you're okay with that, we'll see. But thank you for that. And also, these guys don't really even know me. But there's another couple guys, Todd and Chuck of Compiling on YouTube that do an Astroneer series that's just a lot of fun to watch. You two are a lot of fun. Thank you. You guys helped me get through this. Because watching YouTube videos is about the only thing I really could do while I was recovering at Jeff's. Because, like I said, I couldn't read books. So it helped pass the time, and you two are a lot of fun. So everybody, thank you again. And if you know somebody with cancer going through something similar, again, I'm not going through what somebody with uterine or lung or skin cancer or any of these other really terrible forms of cancer that are stage 4 sometimes. It wasn't. I'm not trying to belittle what they're going through. What I do want to say is what was the worst part about this for me was the location, being in the mouth. That's what the worst part about it was. If it had been something like, the leg or something like that, this would have been so much easier. And if you do know somebody with cancer who is going through something like this, just know what they probably need more than anything else is somebody to be there with them. Most hospitals will allow 24/7 access for limited people, so long as it's quiet. And, it isn't fun to be visiting a hospital. But I'll tell you this, it's even less fun being in a hospital. And I do know some people cannot deal with them. But it means so much to a person to have somebody there. And like I said, it was even better when there was 2 people there and you could live vicariously through their discussion if you're unable to be involved in the discussion. It just helped. So everybody, thank you again. And I do plan to be back and going again, hopefully by the end of April. I really want to get this city going. By the way, you may have noticed spring has come back to Knight's Helm. So there you go, folks. Thanks again. As I said, it has been a sojourn. It has been quite the experience. It will haunt me for the rest of my life. The images that I cannot get rid of my head. I still have nightmares of being connected to tubes and wires. I still have nightmares of coughing up all the blood. Those will never leave me. They will scar me forever as psychological scars, which are probably the worst ones of all. And all I can say is I have great friends and family that are helping me through this. And if you know somebody that needs that kind of support, that is what they need more than anything else. It is the best medicine. So everybody, thank you again. And I will see you in the next episode of City Skylines Knight's Helm. Take care and bye.